Now, let's get more on this story about the Health Ministry extending the period for public comments on health regulations relating to the surveillance and control of notifiable medical conditions, including COVID-19, by 3 months with effect from today. The new closing date for submission for comments is the 5th of July 2022. Now, in the meantime, the department has announced limited regulations with effect from today after the previous COVID-19 restrictions initially imposed under the national state of disaster expired at midnight. The regulations have emphasized that the public will still be required to wear a face mask when entering and being inside an indoor public place. For more, we are joined by the National Health Department's Deputy Director-General, Dr. Nicholas Crisp. Dr. Crisp, thanks for your time.
Morning, Diane, and morning to all the viewers.
Perhaps give us a little bit of clarity about what expired at midnight, the previous regulations that expired, and what does it mean for members of the public now?
Yeah, thanks very much, Leanne. So I think everyone knows that the original regulations to control movement of people and masks and so forth were under the Disaster Management Act. Then when that came to an end 30 days ago, there was a transitional provision of that act that was used to put some regulations in place just for this period. Now that that has expired, there's no more use of the Disaster Management Act or the exemption from that act, and we are now into the application of the Health Act. So what is in place from midnight last night is an extension and a softening of just 3 regulations while the rest of the regulations are reviewed. There was a public consultation process. It was overwhelming response. We had over 300,000 comments that came in. Many of them were just the same and generated, so they looked like they were computer generated, but there were substantive comments. And so to give justice to all of those comments, the Minister has deemed it necessary to extend the period for our team to continue with looking at what's in those comments.
Yeah, important, because I know that there were hundreds of thousands of comments that came through. I mean, when I last looked, it was well over 300,000. I'm sure that number has grown quite a lot. I mean, how many submissions have you got right now? The last that I'm aware of was just over 300,000, okay. And then where they were closed. But that is it, yeah. All right, so that was the number. So now it's been extended by 3 months. So nothing really has changed. So talk to me. You said that there are 3 things that have changed from today. Everything pretty much still the same. What are those 3 things?
So the 3 regulations that now respond specifically to COVID are face mask wearing in public places and gatherings, with a definition of what is a gathering, because there were lots of concerns that what do you do about spaces where people congregate just normally but are not necessarily dangerous spaces like malls and so forth. So there's a better definition of what is a gathering. And then what do you do in a gathering as members of the public? And the third one is people entering South Africa from elsewhere. And there were a number of issues around that. All border posts, which includes our land border posts, which are all open now. And we have, as everybody knows, many borders with lots of different countries and people who come in and out every day, even to school. So we needed to find a way to deal with that and provide exemption for people who are in and out of the country every day. So those are the 3 areas that are now covered. Okay. So a lot of the questionable ones are, particularly when it comes to the indoor gatherings, and I know a lot of people questioning that and wondering, is this something? Obviously, I know there's still 3 months, but as it stands right now, it's still the same that you have to show proof of vaccination if a venue is 50% over capacity. Is that something it's still in place right now? And many worried, I suppose it's difficult to comment now because there has been a 3-month extension, that will basically be going forward for the rest of time. Is that how government would like to see it? No, definitely not. I think, those of us we all live in society, we would all like to see things a little bit easier, but we're moving into winter. We're having increased numbers. We still think we are coming to the 5th wave. I'm personally not convinced this is the 5th wave yet. I think there's something bigger to come. And during winter months, we gather indoors more than we do outdoors. And right now we're in a vulnerable position. We still have less than half of the adult population vaccinated, and we are not as protected as we should be against COVID. So while we are trying to understand the behavior of, and every one of these variants that we see behaves differently, and while we are trying to understand that, we do need to have some protective mechanisms. So there's quite good evidence that not coughing and spluttering all over one another during the winter season does reduce the transmission of various viruses, of which COVID is one, since it's droplet spread. Just when we are in gatherings, just to make sure that we do have some space between us and that we are not all cheek and jowl and exposed to one another in a way that transmission can run away from us.
Yeah, yeah. Quite interesting what you're saying right now about you not believing that this is the beginning of the fifth wave. I mean, we're seeing positivity rates reaching up to 22%, jumping quite high, although, you know, our testing levels are still not at they're quite low. The levels are at around about 6,000. What do you think is happening then? Is this just a little uptick after the holidays, or, I mean, when do you think this fifth wave, when do you predict the fifth wave will start?
So then there are a number of different things of what's happening at the moment. And so this is the first time that we are seeing this kind of uptick that may or may not be a wave. And I know the public likes to define things in very rigid terms. So keep asking us, when do the numbers tell us it's a wave? It's not quite as simple as that. We've never had a wave generated by a subvariant. It's always been a completely new variant. And what we have in circulation at the moment is still Omicron. There are 3 subvariants of the 5 that are still around. They are rapidly being dominated by what's called BA.4 in Gauteng and BA.5 in KwaZulu-Natal, but they're still Omicron. It's still the same spike protein. It's still essentially the same virus, and it appears to be behaving pretty similarly to what the original Omicron did. So it may be, and this is what I personally think, that it's our behavior in this period since the relaxation and the ability to move around more, to spend more time in gatherings and with other people, and especially over the many holidays that we've had, where there have been parties and weddings and so forth, we are more social than we were before. So we have a lot more opportunity for us to transmit the virus. If this were a new variant entirely, something we've never seen before, such as we saw with Omicron and prior to that with Delta, we would probably have had a far bigger number of patients, of cases, and the severity would have been different from what we are seeing now. So we are not certain that this is a fifth wave. It may just be a spike of infections tailing after the Omicron, which never settled down, by the way. Omicron never went below 6% positivity, whereas with Delta we went down to 2% and at times even lower than that.
Yeah.
So it's behaving differently, and we need to behave differently. The bottom line for all of us, we need to take responsibility for ourselves. With or without regulations, we need to behave in a way that reduces the transmission around us and our chances of getting sick. And we need to get vaccinated, because the vaccination is definitely the way to get enough immunity for us individually and for us collectively, so that we don't have to have these kinds of conditions forever.
All right. One final closing comment. I mean, I think you've explained that quite nicely, but just in terms of everything that was documented last night, obviously with this 3-month extension now, there were a lot of court cases and legal oppositions pending against the health department, because people really not happy. A lot of parties and different interested parties not interested in or very concerned, actually, I should say, that's the word, about, you know, draconian measures that are perhaps proposed and too much power given to the health minister. So these legal challenges put on hold now because there is an extension. Is that our understanding?
Well, I'm not sure that it's as simple as that. We have legal challenges to the regulator for registering vaccines. We've recently had a case where the department's been sued by various parties who do not want children to be vaccinated. We also have threats of legal action by parties who want children under 12 to be vaccinated, even though there isn't a registered vaccine. And we have parties who are unhappy with all kinds of things. So I think it's the nature of the democracy we live in, that people have the right to object. They may take the government to court, and we have court cases on both sides of the spectrum trying to get us to vaccinate and to stop vaccinating, getting us to have more regulation and to getting us to have less regulation. I would not like to be a lawyer at the moment. It's an extremely difficult environment.
Yeah, it certainly is. But just in terms of the powers of the minister, because I think that's what a lot of people are worried about, to basically bring us in and out of COVID regulations as he sees fit to. That, I think, is a very big worry as well, besides the vaccinations. That aspect of this whole document is a big worry. Is that on hold for now until those 3 months have actually lapsed and we see what the new proposal is?
So the ministers have had powers since the 70s, and it's pretty much the same powers that have always been in place. One minister after the next has always been given that power. So it is that minister who's accountable to sign whether there are going to be restrictions for anything or not. Nothing has changed. But in these 3 regulations that were published last night, if the conditions change so that there is less threat, the minister may lift the wearing of masks and the indoor gathering regulations and the border control regulations. And if things deteriorate in a month or 2 or 3's time and we do get a completely different wave, then it's within the powers of the minister to reintroduce those three regulations. What will come out at the end of the new consultation period, I can't say. There have been some very constructive comments that have been made, and the department's taking it very seriously, and that's why we wanted more time, so that we get a more permanent set of regulations, not just for COVID, but for better control of infectious diseases in total.
All right, we'll leave it there for now. Thank you. Thanks very, very much for joining us here on Morning Live, giving us a little bit more insight into what's happening in terms of where we are with the COVID infection rate, and also the Health Ministry extending the period for public comments that happened on the health regulations relating to the surveillance and control of notifiable medical conditions, including COVID-19. It's been extended by 3 months now, so we'll see what does happen. The closing date is now the 5th of July. That happened just before midnight. All right, that was Dr. Nicholas Crisp. He's the National Health Department's Deputy Director General.